the disparity in cases of COVID-19 in America.
Communities of color are twice as likely to die from the virus than their white counterparts.
What we're seeing right now is a disproportionate burden of infections and deaths among African Americans, Latinos, and Native Americans. African Americans right now appear to be the hardest hit group, with death rates that are like 2 to 3 times what we're seeing for the general population. A lot of people in those communities are frontline workers who are not able to stay at home and engage in social distancing. So these are the kinds of things that are contributing to disparities in infection rates. We also know that people from communities of color live in neighborhoods that disproportionately have crowded conditions, multi-generation families, and so people come home and then may end up spreading the infection to their family members. Immediately, though, we really need to make sure that there's access to testing in these communities and they know where they can get health care if they need. We need to protect our frontline workers, make sure they have adequate personal protective equipment and enough distance from other people. Sadly, a lot of people don't feel empowered to speak up because they're afraid they might end up losing their employment. But there are different hotlines that you can call to find out where you can get help. There are a lot of lawyers right now that are doing pro bono work. Or you can call the health department and sort of say, I want to make this an anonymous complaint, but I'm concerned that my coworkers and I are getting exposed. And, you can do that in such a way that the health department may send out someone to look at the place without actually disclosing the identity of the person who made the phone call.